What do you think of when you hear the term mental health? Bad, struggle, sick, illness, stress, burnout? When people hear the term mental health, a variety of things come to mind. Here are some common ones that you may hear.
People often associate mental health with emotions such as happiness, sadness, anxiety, and stress. They recognize that mental health influences how they experience and manage their feelings.
The term can evoke thoughts about stressors in life, such as work, relationships, and responsibilities, and how these factors impact one's mental well-being.
Many people immediately connect mental health with mental illnesses like depression, anxiety disorders, bipolar disorder, and schizophrenia. There might be a perception that mental health solely revolves around disorders.
Mental health is also linked to self-care practices and wellness routines. People might think about activities like meditation, exercise, journaling, and seeking therapy as ways to improve their mental well-being.
Unfortunately, some individuals might associate mental health with stigma, misunderstanding, or negative stereotypes. They might worry about being judged or labeled if they openly discuss their mental well-being.
Mental health can also bring to mind the importance of seeking help when facing emotional and psychological challenges. People may consider reaching out to professionals, friends, or family for support.
There could be an understanding that mental health involves maintaining a balance between the demands of life and one's ability to cope. Resilience and adaptability might be seen as crucial components of mental health.
People may think about how mental health affects their daily lives, including decision-making, relationships, productivity, and overall quality of life.
The reality is that mental health is just a term that refers to our emotional and psychological well-being, not good or bad. So often we only refer to mental health when someone isn't doing well and are struggling to maintain their positive mental health. When we only refer to something when it is bad, it's easy for them to become a stigma on it and to not want to talk about it.
So let's talk about mental health in a positive way. Positive mental health leads to resilience, happiness, and effective stress management, enhancing relationships and achievements. Challenges like stress, anxiety, and depression can impact mental well-being, but seeking help from professionals is a sign of strength, and discussing our struggles openly can foster healing.
It's so important to break the stigma around mental health, promoting empathy and support. The more we talk about it, the easier it will be for individuals to reach out for help when they need it.
Watch for next week's video on positive impacts on mental health.